Thank you, Mike, and thank you very much, Juliana, for speaking to us today. I'm sure we'll find out lots of interesting things. So my first question is around how you got to study the topics that you're interested now. So what was your journey into your current field of research? Why mental health and severe mental illnesses, and why studies relating to families and carers?
Thanks, Sally. So I guess probably what's important is I came into research the other way. So it wasn't my first stop, actually. My first interest, although they have changed now, my first interest was actually going to be a children's TV presenter. So and then if I wasn't going to do that, I was going to actually work in finance. Long story, won't go into it. So I actually ended up being a clinical psychologist, and that's the first bit. And I'm a Nigerian. I'm an African. I come from a huge family, and my earliest memories, my only clear memories, is everything was about family. Your discussions, even naming our siblings, was a family discussion. So I don't think, for me, it wasn't much of a surprise that families features as a big part of my work. And my PhD that I did after I completed my own doctorate for my clinical work was on families, and those are families that are sort of impacted by psychosis.
Okay, that's really interesting. Thank you. I wondered whether, because you mentioned your PhD, I wondered if you maybe could let us know a bit about what advice you would give to your former self as a PhD student.
My advice, probably the same advice now. I think you should always do something. I know it sounds like a cliche, but always do something that you enjoy. I think whenever you're doing a PhD, with everybody that's done a PhD, there's always going to be moments that something doesn't feel right. And it's a hard thing to say, but it can be quite depressogenic and really difficult, because you're essentially doing the work on your own. Even if you have great supervisors, it's the work. You've got to be sort of motivated to do that. And in my experience as a clinical psychologist, you can get 60, 70% of the way if it's something that you enjoy, that you like, that it makes sense to you. And I think whenever you're doing a PhD or any big piece of work, you'll always feel a bit lost at some point, whether it's recruitment, writing, not getting the results, but it's got to be something that makes you smile.
Yeah, I think that's really good advice. Yeah, thank you. You just mentioned, for example, that sometimes you can be maybe doing your work alone, although you have the support from your supervisors. It's predominantly your work. So we know that you also work with researchers from other universities and have collaborations. So obviously that would be a good way to kind of complement not just working on your own. How did you go about creating those connections and collaborations?
I do it from day one. I did it from day one, and I would always encourage my students to do it from day one. I think you learn, for me, I just think it's about the learning process. You learn so much more when you're talking to people, if only if you're just articulating what you're thinking. And I know even in my department, when I was certainly doing my PhD, I mean, yes, I used to keep people hostage in the kitchen, but I was just really nice just to talk to people. And then you hear things. There's always the sort of classic cliche going to conferences. I think that's great, but we also recognise not everybody really likes going to conferences sometimes, because it can be for some people at some point in their life might feel like a big social thing that they need to do, that they don't feel comfortable. But even like if you're in your university, there will be different talks going on, different events, and it's literally just coming out of your own box, speaking to people, and just seeing, and not just being with the people that are doing exactly the same sort of work, because you tend to circulate the same sort of ideas.
Yeah, thank you. I guess also we could be using our network of other scholars here as well as a starting point to build connections between between us and other universities. Thank you. What would you say are you most proud of in your career?
What am I most proud of in my career? Loads of things, actually. You know, I'm probably not doing the sort of socially acceptable thing, so it's just one thing. Loads of things. I'm proud of the fact, I genuinely love the fact that I get to do something that I really like. For me, working with the groups I work with clinically, it's a really good thing, because my ideas, the work I do has very much come from that. And then also to be in a position where, you know, I can be involved, whether that's at policy level or literally on the ground in terms of trying to translate, implement, make sense of what you're trying to do in research, is really good. So it's a bit more of a historical sense of being proud in terms of a longer term approach. But I'm proud of the fact that I'm privileged to work as a clinician and a researcher.
Yeah, great, thank you. Maybe as a follow-up question from the one from something you just mentioned, how can we make sure that our research has a clinical impact, so that what we work on actually, you know, gets recognized and has an impact and can actually facilitate change?
Yeah.
Do you have any suggestions for that?
Very interesting, actually. So I went to a talk last week in my college about impact. Mm-hmm. And the biggest piece of work that we need to do, and this is for ourselves as researchers and all the supervisors here, whatever your level, is to kind of redefine what we think about impact. Because there are some people doing such early phase work that they're not going to see what happens. And if you kind of assume that's impact is only because, I don't know, you've got into a journal that's, 5,000 impact factor, that's just not, that's one type of impact, but it doesn't define impact. Impact is about sharing, making sense, helping people just to kind of get ideas. So I think if we just take, for example, now, any students here, sharing and disseminating your work, I think is a really important way to have impact. Being involved, and the work that you get with your advisory groups, your lived experience groups, sharing things here, using different mediums. It doesn't have to, it's not always the big shiny lights. That's not the only type of impact. But I would certainly say impact does happen by sort of coming out of your own box. You won't just get impact just sitting in front in a lab or just on your desktop.
Yeah, important to share what we learn. Thank you. Now, maybe changing the topic a little bit. We know that mental health research is not as inclusive or diverse as it could be. What do you think needs to change to improve mental health science for diverse populations in the UK?
Well, it's a really big issue, and it starts with us. That's what it fundamentally does. So first of all, these are groups that they're not hard to reach. So always thinking about people's language, they're just underrepresented. For us to recognise in charities like this and students like this that there is that direct pipeline between what we research, what gets prioritised, and the quality of our services. So we need to do better in terms of making sure that we're not introducing or maintaining barriers and obstacles for people to be involved. We saw the downside of that when we just went through the pandemic. So when you're thinking about a study, who is your sample? What are the things that you're thinking about to make it more inclusive? Do you only approach groups when you want them to be involved in research, or were you doing your sort of groundwork beforehand? Where do you, in terms of topic areas, how do people feed into that to sort of prioritise the areas that they want to think about, as opposed to just thinking about, certain ways that we want to do it. So we need much more inclusivity in our research, much more inclusivity in how we write about it. And actually we see that now even in funding bodies, where there's much more attention to thinking about diversity and inclusion. So not just sort of tokenistic stuff, but real meaningful change. And that relies on us all.
Okay, thank you. My next question is about funding for mental health research. So we know research is underfunded, but the awareness of mental health in the population is increasing. How can we persuade the general public of the need for properly funded mental health research?
Well, I think actually, Ali, that goes back, it links back to 3 questions before as well about impact. If I don't know about things, how can I even agitate for it? I often agitate for things if I've had a lived experience in the general public, but actually, drawing attention to an area is really important. A few weeks ago, we saw, some of you may have watched this wonderful program with a well-known celebrity talking about her own experiences in terms of living in a neurodiverse world. It drew attention, and it's not just, I'm not just saying it's just because they're celebrities, but it's also about, as a researcher, if we don't get our information out, if we don't share it and think about different mediums to share that, then that's really hard for people to get behind that as well. And also there's a reality. We do know it, it's sad, but there is still a hierarchy in terms of where we put our funding. Where we're at now in relation to cancer, we weren't like that many decades ago. We need to kind of keep agitating and pushing and encouraging people to talk about that and think about, if we want better services for children or older adults or any of those groups, they also rely on research. And that research relies on publicity and, our policies. So always thinking about that.
Okay, thank you. I now have another question kind of specifically related to some of the work that you've been doing. I saw your education tool online for carers and families for patients with severe mental health disorders. I just wondered how you went about that, what steps you took and how long it took you to make such a wonderful tool, which I find is amazing, by the way.
Thank you. Well, initially I was only able to do that through industry funding, having some industry funding, because again, whether people get tired of wanting to hear about this, but, we don't think a lot about our families and carers who are affected by having a close relative living with a mental health problem, and certainly one that attaches a lot of stigma, which is around psychosis. So we did a lot of work in terms of doing our consultations with the groups that would be impacted by the course, think about what they wanted, how they'd like it to be. We worked with a different company to kind of think about getting the visual feel okay. And then we worked with all our leaders in terms of our course team to think about how you translate information and data in a meaningful way. And I guess, if I'm just doubling back on one of your questions before, as researchers and academics, most people might be great at writing papers and, again, sitting in front of the desktop, but communicating that in a meaningful way to groups who could actually do something with that is a lot of hard work. So I think just making sure we're trying to do a lot more of that. And that's what we were doing with our course team. And, we've been running that course now for over 7 years, and we've had over 55,000 people that have been on that course, and across the globe on all continents, and we're always trying to update it in that way. But for me, it's a real example of how you can kind of work with different groups, whether you're your own person who's got the lived experience of being a carer, or someone with their own experience with psychosis, or an academic who wants to share their knowledge, or anyone else. It was kind of trying to get that together in a balanced way.
Yeah, no, it's amazing, and I'm so sure it has a lot of positive impact on the people that are doing your course. I think it's really great, and also nice that it's free, so it's accessible to everyone. There's no barriers to it. So yeah, I think that's really a kind of admiring piece of work. I think that brings me to the end of the questions that I had prepared. I don't know if anyone else has any questions for Juliana.
Thank you.
Thank you very much.
Thank you.